Welcome to Hit Show, your go-to source for today's leading healthcare business headlines. I'm your host, Rhonda Brooks. Today on Hit Show, CMS expands access to catastrophic health plans as 2026 premiums surge. New policy requirements accelerate EHR transparency mandates. Rural hospitals face a crossroads between emergency bailouts and collaborative networks. And we'll close with an interview about microlearning that's cutting nurse training time by 75%. We start with the latest policy news. CMS is expanding access to catastrophic health plans as insurers brace for substantial premium increases next year. Nate Collier has the details.
Thanks, Rhonda. CMS is expanding catastrophic health coverage access due to projected substantial premium increases for 2026. Health insurance premiums are expected to rise significantly across the individual market, representing one of the most significant increases in recent years. The new guidance allows consumers who become ineligible for premium tax credits or cost-sharing reductions due to their projected income to access more affordable catastrophic coverage. Starting November 1st, there will be streamlined application options through healthcare.gov with automatic hardship evaluation.
Nate, what should health system executives be looking for?
Rhonda, this could significantly impact charity care and uninsured patient volumes. Health systems need to adjust their financial assistance strategies as this policy change affects their patient populations.
Important timing with open enrollment approaching. Thanks, Nate. New healthcare technology developments are accelerating transparency requirements. Peter Betterworth has the details.
HTI-4 is pushing forward on prior authorization and price transparency rails. Commentary today underscores accelerated requirements for real-time pharmacy benefit, or RTPB, and electronic prior authorization, or EPA, integration in EHRs. The rule takes effect October 1st, 2025. Providers and vendors should check timelines as these mandates are coming sooner than expected. The push aims to reduce administrative burden on clinicians while giving patients clearer cost information at the point of care. Health systems will need to ensure their EHR systems can handle these new integration requirements as they roll out.
Peter, what should leaders be prioritizing?
RHONDA IT departments need to work with EHR vendors now on implementation timelines. Systems that aren't prepared could face compliance challenges. Also, we'll have live updates from Fierce Pharma Week starting tomorrow with more insights on these policy developments.
Thanks, Peter. Speaking of Fierce Pharma Week, stay tuned for our upcoming coverage starting tomorrow with live updates from Philadelphia. Coming up after the break, rural hospitals at a critical crossroads and an interview about workforce innovation that's delivering impressive results.
Hit Show is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care, their way. The journey toward the summit of healthcare has begun, and through partnerships built on trust, Sunrise is helping healthcare organizations bring next-level care within reach.
Welcome back. Rural hospitals are facing critical moments, with some requiring emergency intervention. Anika Shah reports.
Palo Verde Hospital in California, the only acute care facility within a 100-mile radius, received emergency state funding after suspending new patient admissions in May. The state provided $8.5 million and debt relief extensions to keep this critical facility open. Representative Raul Ruiz called the potential closure a public health emergency that would leave a massive healthcare gap in one of the state's most underserved regions.
Anika, is this funding model sustainable?
It's really a last resort, Rhonda. While it keeps doors open temporarily, long-term sustainability remains uncertain.
Thanks, Anika. While some hospitals need emergency bailouts, others are taking a more proactive approach. Teresa Vaughn has that story.
Independent rural hospitals are joining clinically integrated networks to share resources while staying independent. The Rough Rider Network in North Dakota includes 22 hospitals using combined patient roles to negotiate better prices for services like mobile imaging. Since 2010, 153 rural hospitals have shuttered completely, while 441 merged with larger systems. These networks provide negotiating leverage individual hospitals can't achieve alone.
What's the key benefit, Teresa?
Volume, RHONDA. Vendors want big contracts and will give better pricing. It's allowing rural hospitals to remain independent while gaining benefits of scale.
Thanks, Teresa. To close today's show, Jalen Cross has an interview about a training platform delivering impressive results for hospital workforce challenges.
Thanks, RHONDA. This workforce innovation is solving real problems for hospital leaders dealing with staffing challenges and training costs. I spoke with Tim Coulter from Elemento about their micro-learning solution that is transforming hospital training. Tim, what's different about your approach?
Traditional training structures are failing because they assume uninterrupted access to time, space, surplus labor, and these conditions just don't exist in hospitals today. Nurse educators are stretched thin, coverage gaps are filled with agency labor still at 2.5 times the base rate, even after COVID. In a much more real sense, nurses need similar tools when they're working with patients. They need to be able to have that kind of information in a short, bite-sized, just-in-time manner, whether it's in a video or a short form text guide aid. And that's what we do.
What results are you seeing?
We're seeing great reductions in the amount of time it takes to onboard and orient a nurse. So we're seeing 75% reductions, which equals great time savings for the health systems. We're also seeing huge reductions in specific outcomes. So for example, a 48% reduction in CLABSI, and being able to look at also reducing patient harm by about 78% as well. So we're seeing great outcomes on the quality side, as well as on the onboarding and orientation side.
How quickly are you growing?
We are now approaching 100 hospitals across the country. And in fact, we have recently found out that we made the Inc. 5000 list of one of the fastest growing private companies in the country, which is a testament to the outcomes that we're producing for our clients and for the hard work that our team is doing to be able to drive those outcomes.
Impressive outcomes solving real workforce challenges for hospital leaders.
Great results there. Thank you, Jalen. That's all the time we have for today. Thank you for joining us on Hit Show. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on hit.show. Hit Show, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. Hit Show is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, kimchi.com.